Ready?
Both ready?
Yes, I'm ready.
Take your time. Both ready? All right.
Yes, ma'am.
So, yes. So, if you've read and understood considering it communication skill station, please begin.
Okay. Hello, my name is Dr. Ala Abdullah. I'm one of the surgical team here.
Doctor,
So,
how could you take my son to the operation theater? What did happen to him?
hi, ma'am. I know you are very frustrated and you are very worried about this. I'm here to help you and I'm here to talk to you about all of this. So, if you could help me, please, can I just check that you are Michael's mother?
Yes, I'm Michael's mother. What happened to
Yeah,
him?
yes, I will tell you, ma'am. So, how can I address you, ma'am? And I will tell you everything. Okay, ma'am. Ma'am, uh, as you know, Michael has been brought to the hospital today, and he has been unwell, and his condition was serious. But he is now in the operation room, and he is receiving the appropriate treatment. So before we go more onto that, ma'am, can I ask you just what do you know about his condition? What do you know so far?
One of my neighbor called me and told me that my son has got injury while playing in school, and his father has brought him to the hospital. And I came to hospital with so much worry. Can you tell me what happened to him?
Yes, ma'am, absolutely, ma'am. Well, ma'am, your son has fallen from the swing and he has been brought to the emergency today. We have examined him and we have did a scan. It's called the ultrasound, like the one we do for pregnant ladies. But
Okay, what's the result of the scan?
unfortunately, we have seen that there is a fluid in the tummy of Michael, and we suspect that there is an injury to an organ in his tummy called the spleen, ma'am.
What is
Are you?
pain?
Yes, ma'am. I will explain it to you. So, ma'am.
Draw and yes. Explain.
So, ma'am. Uh, this is the spleen. This is the tummy, okay? And this is the tummy, okay? The spleen located here, in the left side, okay? It's just beside the stomach. So where it is located, the spleen can be injured very easily, and with an injury like that, we suspect that it has been injured. But so why I'm talking about the spleen, ma'am? Because the spleen is important organ. He work as a checker for blood cells. Okay, and he also has take a part from of the defense system against infections. So
Okay,
we
can
did,
you please tell me why did you take in my son for the operation without my consent?
yes, uh, well, we needed to do an urgent intervention for your son, ma'am, because the spleen, as I told you, contain a lot of blood, and if it injured, this might cause very unfortunate and serious events like bleeding in the stomach. So, in that case, we follow the protocols and we do surgery for the spleen. And but let me assure you, ma'am, that our surgeons are very experienced with this. As I told you, this is a very common injury. So we encounter a lot of these injuries, and our surgeons are very uh, experienced with this, ma'am.
Okay,
So
what did his father told you?
yes, when his father brought him to the hospital, he told us that he has fallen when he was playing. So we just started on checking on him and on the management. Do you have any concern about that, Miss, ma'am?
Yes, his father is drunk and I want to protect my son.
Absolutely, ma'am. You have all the right to protect your son. Well, ma'am, in that case, we have no authority to judge on the father, but we have tested him, and we have saw that he is in a fit state to take a decision. And I'm sorry that you have not been contacted so early, but this was an urgent. So we decided to go for the operation right away. And I'm here to talk to you about everything, man.
But I'm
So
worried about my child's protection. What can you do about that?
yes, ma'am. Well, in that case, in these cases, we usually inform the social workers. They are very concerned about our child protections. So they will search and look for the safety of Michael and the housing condition. And the child protection consultant will be following that. So your child will be safe after the operation.
Okay, is there any
Yeah.
medication that he will need after operation?
Well, yes, ma'am, this is a good question because when we take the spleen, this might be a possibility to take the spleen out from the surgery. So, as I told you, the spleen play a part in defense mechanism. So, in these cases, Michael may be susceptible to some infections, some serious infection like bacteria. So we have to give Michael a vaccines in this case until he reach 16 years of age, and also he need to be given antibiotic. We need to give him antibiotic until he's 16, and he will also receive vaccines against this bacteria. I'll,
How long is the operation going to last? Can you please take a look for me?
well, until this moment, it's early to judge on that. But we will see what will happen, and this depends on the condition of Michael.
When can I
But
see him?
well, ma'am, this also early to say, but I promise you, after Michael get out of the theater and the recovery room, we will keep monitoring him and see him and check him. And when he get out safely, we will tell you about this, and I will bring you as soon as possible to meet him.
Okay, when can I take him home?
Well, ma'am, I know you are very concerned about this, but your child's safety is our priority. So we have to make sure that he is in good state and that he is fit to be taken home. So we'll keep checking on him after the procedure and we'll keep observing him. And when he will be fine, he will be ready to get out. Okay?
Okay.
Okay. Do you have any other question, ma'am?
No.
Okay, ma'am. So, ma'am, just to make sure we are on the same page, could you just tell me what I have told you?
Do you want me to sign a consent?
Yes, ma'am. Yes, ma'am. Okay, ma'am. As you are the biological mother of Michael, we need to sign this consent for the procedure. Are you okay with this?
Okay, I'll sign.
Good,
Okay,
thank you.
thank you, ma'am.